these are the types of sex therapy: cognitive behavior therapy, interpersonal therapy, acceptance commitment therapy, and problem solving therapy. Though this is a word we are using it, but what I'm doing practically in my OPD, simple way. Whenever patient comes for counseling, I ask them something. Sometimes patients say, maybe I ask them, you are both married with your own consent in beginning? Yes. Then after this, we know their nature, we are not now adjust, and I'm getting now more and more boring, and I'm getting more and more tension and these things, and I want to be separate. Okay, fine, don't worry. I immediately, you will get the divorce, don't worry about that. But 1 month you follow my instruction and do it. Your negativity should be removed from the mind. How to remove the negativity of the patient? Patient feel that, oh, I'm married. Mostly female patients, they become, oh, my life is now totally, she was so much money, and I will, after separation, I will not get it, and all the tension of stress, of monetary stress, and other stress, and other things together. In such cases, you have to remove the negativity from the mind. So ask them to write down every day what is the aim and object of your life, and positive thinking should be there, or what you feel. Or I say, write down, this is the universe is a very good, or is a wonderful society, whatever way you can say. I am very happy, my parents are very happy. You may be or may not be happy with your friends and all. Write down, but I am happy, everything. Write down happy, and positive, no negative. Then they feel that, oh, I am the aim to do something. The marriage is a part of 10 to 20% of the life, but other part to do myself better. Whatever your age, you can do the better. You open up. I am thinking at the age of above 60, I am thinking about, if my son is in US, my daughter is in Canada, what will happen in my future? Suppose my wife also goes there, what will happen to me? Nothing. I will become bored. Then I said, no, I can do it. Then I presented my book. I accepted Amazon. So do that way. Change your work pattern. That will be enjoyable to you, and do for society, do for your satisfaction. Money is not a criteria. Everyone have the money. Of those who are attending this, everyone have 3, 4, 5 crore rupees with them. Maybe in the form of asset, maybe liquidity, maybe non-liquid asset. But that is not the things. What we want in our life is satisfaction. And don't expect anything from anyone. Expectation leading to frustration. But from today, always teach your patient, don't expect from anything from your wife. Wife should not expect anything from husband. Whatever is going is just, we are the friends. So we ask them, first week they will not talk. During my counseling, 1 month they will not talk, husband and wife. Remain will only they can do with their facial impression. Only if they want, they can hug, they can laugh, they can do, if their mutual understanding is proper. Otherwise, forget about this. Write down this, positive. Then in second week, we want responsibility. I give the very vague idea. When you going on the road, suppose your bike stuck to the something, there is some gadda or something there, and you fall down. What happened? Who is the responsible? He said corporator is responsible, they are not working. Who elect corporator? I elect corporator. Means your vote is very important. If you elected proper prime minister, then prime minister will do for you. You don't think, अरे कोई भी गधा वधा आ रहा है, दे रहे हैं, और then रो रहे हैं, अरे क्या कर रहे हैं, कर्जे में है, कर्जा क्या? This is things what you have to understand. कि everything, who married this woman? I married. Then who's responsible? My responsible. Then ask the lady, who married this gent? Are you married? Because 90% character of species wise is the same. Whether horse cannot become a donkey, donkey cannot become horse. So my dear friend, what you have to do in this counseling session, that very important. Accept the things as it is. That is Brahmasmi. Means what? I am a God. And if you want to die, you can die after 100 years. If you think, if you say, oh, I'm dying today, so you will die today. That up to you. Tell to your patient. If you want to be happy life, always remain happy. Happiness bring the happiness, and sadness bring the sadness. So today's home message is that be happy. Anybody want to be crush your happiness, don't worry about that. You be happy. This is our today's counseling program. Now sex therapy is over, my dear. This preset model is very important. Whenever patient comes to you, have the permission. We are going to talk with the patient and doctors on the sexual related things and limited information. Suppose I have done the masturbation or my size of penis is very small, that will nothing. Penis is not the sex organ, but vagina is not the sex organ of the female. When the baby inside the womb of the mother, the embryonic stage of that baby, up to the 2 months, there is no sex determination. After that, the sex determination, because the sex ectoderm, phallus of ectoderm, develop to the penis in the male, and same thing develop in the female as the clitoris. Means clitoris is a sexual orgasm organ of the female. That you can understand. Always keep in mind whenever you're treating the sexual cases and OPD. That's the way what sex is. Clitoris is the clitoral stimulation from the outside. That's why female get orgasm after orgasm, because the clitoral stimulation is outside. And your penis size is no matter. It is just like what you called collapsible tube or syringe which pass the sperms to the os of the uterus for the fertilization. Nothing more. Now, my dear friend, we go ahead. I'm not. I teach. I have already completed. Still, those are not. Anyway, now we go ahead. Cognitive behavior therapy and all these are part of this therapy. You just do this personality evaluation. This much is the counseling. Is the best counselor. You become best counselor, best advisor. Yes. I'm sorry. Now, always learn to say I'm sorry. This is over. This already I completed this, and now sensitive focus is over. Counseling program is over, and that is a. I want to remove someone, those who are disturbing, and they keep their. Who is keeping Deepak? I am going to remove you, Deepak, because you are not muted yourself. If you mute, then I will not remove. Otherwise, I am going to remove. I remove. Okay, I removed one fellow. Anyway, we go ahead. And now again we will be at our site. Where is the practical assignment? Improved session. Okay, fine. We make it to be small. What happened to here? Okay. Your screen sharing should be continued. Okay, fine. Okay. Thank you for submitting. Okay, fine. Now meridian. There are whatever organs inside the body is representing outside with the meridians. So mostly we erectile dysfunction and premature ejaculation patient, we give them sacral stimulation and lumbar stimulation by this TENS and EMS instrument. That is called kidney meridian and urinary bladder meridian stimulation will help to remove their disease, but this needs times. Not one treatment the patient do at their home. That TENS with EMS machine they purchase, and our WNH also prepared that machine, and with the under product these things government recognized startup we had to do something, so we had prepared this unit for our patient through the international what you called Johari Digital or Electronic at Jodhpur, and that is having more than 100 crores export in the US and US market and all. They are developing all the things, even shockwave machines and other things, physical therapy machines and all. Now this stimulation we will take one hands-on training, we will teach you, but those who want, we will one day we will bring the machine and we will show on the Zoom meetings and we'll go ahead. Now my dear friend,